This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. Tonight, we continue our COVID conversations. We want to get to the heart of COVID-19's impacts in our region and what they've meant for you. For more on that, I'll turn it over to my co-anchor, Mark Kiesling.
Thank you, Julie. We are joined tonight by Ashley Hofer, a nurse practitioner. Ashley, thank you for being with us tonight.
Thank you.
Now, let's start off by telling everyone a little bit about your role, where you work, and what type of care you provide.
Well, I am a family nurse practitioner and I work at Crossroads Internal Medicine in Mount Vernon, Illinois, and I provide just primary care for all ages from birth to death. So I see a little bit of everything.
Can you describe to us a little bit about what you're seeing when it comes to COVID-19, the types of patients you're seeing, some of their symptoms?
Really, what we're seeing in primary care, usually the big telltale symptoms for patients to call and say, I think I have COVID, would be just a general kind of feeling of unwell, as well as loss of taste and smell. We get a lot of patients that have just kind of a cough, sinus type symptoms, and then some patients with some belly symptoms such as diarrhea. But that's our big symptoms we see in primary care.
Now, what type of symptoms do you see in people who are bad enough that you suggest that they go to the hospital, or you say you must go to the hospital for care?
Right. Those are the patients that call and are having issues breathing. Any patient who has respiratory distress or a feeling of not being able to get enough air, those are the patients that we immediately send for a higher level of care, such as an emergency room.
Now, we know that some patients are in the hospital for COVID-19, but not all of them are on a ventilator.
Right.
So how bad does it have to get before someone is then placed on a ventilator?
So oftentimes when patients are initially hospitalized with COVID pneumonia or COVID-19, they're just placed on a lower level of oxygen, or they're there just for very close surveillance. But that's what's so scary about COVID-19 and COVID pneumonia is that you can go from bad to worse very quickly. It escalates very rapidly. And those are the patients when their oxygen saturations start to fail, they start to drop pretty quickly, and we're finding that their bodies are no longer able to oxygenate and ventilate, and they require support when we actually place an airway to take some of the stress off of the body so that it can try to heal.
Okay. Now, do you actually give out COVID-19 vaccinations at your office?
Not currently, and that is basically because of a freezer. Because of these vaccines have to be kept in such a cold temperature until they're ready to use. They have to be kept in a special freezer, and we don't have that on site. But the great thing is that all of our local pharmacies have this. We do have it at our local hospital and have the ability to get it. And I know that our office staff is currently working on getting us the freezer so that we are able to store them when necessary.
And that is not uncommon. I'm hearing that from a lot of doctors' offices and clinics that they don't have the resources right now to give out the vaccines, and they do recommend people go to the health departments or to the pharmacies.
Local pharmacies. I know all of our local pharmacies in Southern Illinois have been very helpful in helping to keep the vaccine available for our patients in our community. Since
we've had this Delta variant spike, have you been seeing, more people coming to you with COVID symptoms, and then have you also been seeing more people inquire about getting vaccines now that this spike has hit?
Yes and yes, and I actually am very glad that you asked about that, because it's a scary thing with the Delta variant. When COVID was first kind of an issue, we were finding that about 3 out of 10 patients who were exposed to COVID were becoming ill. And the scary thing about the Delta variant is we're finding that about 7 out of 10 people who are exposed are becoming ill. So it's much more virulent, it's easier spread, and it's also kind of scary because it's affecting our kids more than the other variants have. So so I think that with it being publicized and being public knowledge, people are more aware of it, and it is something that concerns them, which is where primary care steps in and tries to educate them about their risk and about what they can do to protect themselves.
You mentioned trying to educate them about the risk. What is some of that education that you offer to people about COVID and about the vaccine?
Right. So number one, we want to educate you about the risk of transmission, what you can do to protect yourself, which is definitely common sense. Wash your hands. Your hands are the most dirty part of your body. Wash your hands. Use hand sanitizer if you don't have a availability to wash your hands. And if you're going to be in an area where you can't social distance, or if you're going to be in a place that has a lot of people in a small space, definitely make sure you're wearing your masks. I am fully vaccinated, but I like to wear my mask when I grocery shop, not
Same
only
here.
for my protection, but also for your protection,
Right.
because I see a lot of patients every day, and there's always the possibility that I could be exposed. So I want to do whatever I can to protect you. When it comes to vaccinations, the big thing that I want people to know is that we want you to feel comfortable. Nobody wants to bully you into taking something that you're not comfortable with, but what we want to do is educate you on why it's so important that you get vaccinated, because it's our best way to try and prevent the spread of this ridiculously scary virus. And to try and protect you and your loved ones and keep you well. The really cool thing is that it is now FDA approved, the Pfizer vaccine, so I know that that's helped a lot of people to feel more calm about it. And in primary care, it's so important to have a good relationship with your provider, because we want you to trust us.
Right.
We're going to take that risk for you. I took the risk and got vaccinated when it was very first available, and I did my research. I've read all of the journals. I would not recommend it if I didn't feel that it were safe, and I totally recommend it.
Now, earlier this evening, we reported that the Southern 7 Health Department reported to us 44% of its current cases of COVID-19 are in children 19 and younger. Are you seeing similar numbers, increase in cases among children?
We are. I know that in Jefferson County, over 194 positive cases in 7 days, and 33% of those were kids. With school going back into session, it's definitely something that we're going to see. Kids are very social. They're so social, and it's such an important part of their lives.
Right.
But it's super important that we as healthcare and we as parents educate these kids to let them know their risks, encourage them to be together socially, but do it safely.
Now, from your experience, how tough has this virus been on healthcare workers?
So tough, so very tough. As a healthcare provider myself, I could sit here and tell you all night about the stress that I have experienced, but I think what hurts me the most is that as a healthcare provider, I care for other healthcare providers, other doctors and nurses and clinical staff, and I can't even begin to tell you the increase in depression and anxiety and almost post-traumatic stress-like disorder from these people who are giving their lives every single day to try and help people who are critically ill. The best thing I can say is please do your part. Our healthcare system is tired and we need your help.
They need a break, right?
They need a break, a much deserved break.
And finally, what is your message to those of our viewers who continue to see this battle with COVID-19 just drag on and on?
I feel your pain. I am sick to death of COVID-19. I'm sick of wearing a mask. I understand. But I can tell you, from someone who has to deal with watching her patients suffer, and as a granddaughter who lost her granny to this terrible, terrible disease, my healthy granny who passed away 3 weeks after diagnosis, I can tell you it's devastating. No one should have to watch their loved one passed over an iPad because they can't be with them. And the sooner that we take care of this by, vaccinating and just, buckling down and taking care of one another and protecting one another, the sooner we are going to find an end to this pandemic.
All right. Ashley Hofer, we thank you for being with us tonight and
you.
sharing your experiences with us and some great advice as well.
Absolutely. Thank you so much.
Thank you.